physician was allowed to supervise up to 5 physician assistants, but they didn't have to be present. They had never seen our clinic. They had never seen the work that we did. They've never interacted with any of our patients, nor did they have the opportunity or the ability to, unless they were to have flown to themselves physically.
If someone has the skills and capabilities to do whatever it is to prevent them from doing that that's unjustifiable. It's having a Ferrari in the city. What's the point? And I think that just frustrates the person, it wastes the resource, and it probably does a disservice to the public.
Without the supervision requirement, I was able to open this practice. And this practice has enabled me to provide care for my community. People can come in and see me, and not just see me once, but form a relationship with me, partner with me, and I can continue to serve their needs for years to come.
It's not just the number of patients, it's the services and the availability of that patient to get the help, and to get the help when they need it the most.
A lot of times I've had care from a MD, and I felt like I was rushed out of the office. I would see them for a few minutes and they would be gone. But she actually spent time and paid attention to detail with regards to my care.
You can get into them quicker. They're non-judgmental. They sit and listen. They're very understanding, and they care.
For most of my life, I've gone to MDs, and I was pleasantly surprised how wrong I was with that type of prejudice that I had against PA. I am all in favor on every state in the country to allow PAs to practice like they're able to practice here in Iowa.
The work is not done. We need to continue to push forward and make these changes that we've had in Iowa available to every single state, so every patient has the access to the care that they need and that they deserve.